Hello, one and all. Today we have seen the second part of skin grafting. So already we finished the skin grafting, that introduction, how the skin grafting done and who is first done skin grafting in lamp and how the handle is introduced and like that. So after that we have to discuss. We have discussed already about that anatomy and physiology of the skin and structures. That is what is the functions of skin and epidermis and dermis and how blood supply of the skin is there and stem cells. Like that we have seen all these things. And now, today is how the graft is uptake. Graft uptake is taken. So that is the mechanism of graft take. Today we will discuss. Okay. So coming to the graft take. So we will see graft take. So we all know graft take is having three stages, that is imbibition and inosculation and remodeling phase. So for these phases, the time period is 48 to 72 hours imbibition and 48 to 21 days for inosculation and 21 days to 1 year for remodeling phase. So how this stages is going to produce graft take. We will see that. So what we are doing grafting for why? We want to cover the wound. Okay. So for that we have to take that graft and that will fix to the wound surface. So this is the concept of graft. So grafting. So graft take, that is adherence of the graft is called as graft take. So that is produced by three stages. Okay. So adherence of the skin to the wound surface is done by carried out by three stages. That is one, imbibition. Okay. So coming to the imbibition, so that is 1 to 4 days, that is 48 to 72 hours, and oxygen and nutrients diffusing through the plasma between the graft and the wound bed will nourish the skin graft. See, that graft is survived for 48 to 72 hours. We have need nutrition and oxygen. So, because we are detaching the blood supply from the, what is graft? It is transfer tissue from one side to another side without its own blood supply. So that is grafting. So we have to, for survival, nutrition and oxygen is needed. So it's oxygen and nutrients diffusing through the plasma between the graft and the wound bed. So that will nourish the skin graft. So that is imbibition, that is first 48 to 72 hours. Okay. And coming to the inosculation. Inosculation is otherwise called as revascularization. Simple. If that nourishment first 2 days to 3 days, it is from the diffusion. After that, that blood vessels formed to the graft and that will taking care of the graft survival. So that shows the pinkish discoloration of the graft after 3 and 4 days. After that first look, we have to see the graft color change. So that is 3 to 21 days. Here, three hypothesis is that how that revascularization occur in the graft. So here the graft is having the blood vessel and here the wound bed also having blood vessel. So that will anastomosis end to end like this. So the cut ends anastomosis with each other and the blood supply is regaining. That is one hypothesis. Another hypothesis, neovascularization, that is ingrowth of the blood vessels from the wound bed to the graft site. That is neovascularization. Third hypothesis is the ingrowth of the endothelium only. The blood vessels in the graft site is endothelium is peeling up and the vascular structure is there. In that structure, vascular structure, the ingrowth of the endothelium occur and that will produce revascularization. So these are all the three hypotheses is there in the emasculation part, that is anastomosis, neovascularization and endothelial cell ingrowth. So coming to the remodeling phase, that is maturation phase, that is 21 days to 1 year. So here maturation part is taking care of fibroblast. So fibroblast is acted upon by smooth muscle actin. So alpha smooth muscle actin. So that will form into myofibroblast. That myofibroblast is taking care and producing the remodeling phase of the graft tape. So that is very important for remodeling phase. If myofibroblast is overacting, so the wound contracture is more, and the graft contracture is more in thin grafts. So that is due to myofibroblast activities. Coming to the skin appendages and functional structures, because the skin having that sweat gland, sebaceous gland, and hair follicles, nerve endings. So we have taken all this from grafting. So that will have that full thickness and composite graft will show hair regrowth 2 to 3 months after grafting. Okay. So full thickness graft, hair growth after 3 months. Patient regains sensitivity of the grafted area after 1 year, but the result is not completely normal. So, patient regaining sensitivity due to nerve growth from the wound bed. So, that is regaining after 1 year, but the result is not completely normal. Some abnormal sensation is there. So, that's why we have advised the patient to take care of the graft with avoiding from thermal injury and any other trivial injuries because of sensation is decreased in that area. Okay. So neural connection to sweat glands will reactivate their function up to 3 months after grafting. So if partially the basis glands is reactivated by reinnervation after 3 months. So that only we have to taking care of the graft with paraffin application. So every 2 to 4 hourly for 3 months to 6 months to taking care of the graft. It will break down that because of that dryness of the graft. So we have to taking care with paraffin dressing. So neural reconnection to sweat glands reactivate their function up to 3 months after grafting. For this reason, moisturizing of the skin graft is advised for at least 3 months to 6 months. That we are using the paraffin or coconut oil. So this is the mechanism of skin graft take. So we will take the clinical application and how to do grafting and how to tackle the complications in next video. Thank you.